Hi, so in this video I'm going to be talking about the weeks 15 to 17 of pregnancy. At week 15, your baby is the size of a pear. By week 15 of pregnancy, your baby is now starting to grow hair on their head and even have tiny little eyebrows. They're able to now move more of their limbs, so they can move their arms and bend them from the elbow. Your baby can now touch their own face. Because of your baby's neurological development, there are now messages being sent from your baby's brain to your baby's muscles in their face, so your baby can now form expressions. They can now squint and frown. And at this stage, your baby is covered in what we call lanugo, which is a hair. So your baby is covered head to toe in hair all over their body. But this is important because this keeps them nice and warm in that watery, light-wet environment. So around 15 weeks is when you might have started noticing that you're not sleeping as well. So that's not uncommon. It's not uncommon for you to start to experience bouts of insomnia, where you're wide awake at night for hours on end. That's quite normal, and you might find you go through periods of that during the pregnancy. If that's the case, then just try and adapt your lifestyle during the day. Try and fit in regular naps so that you can start to replenish some of that sleep that you're losing, because it's really important that you do get plenty of rest as well. At week 16, your baby is the size of an avocado. So at 16 weeks of gestation, your baby can now form a wee. So they're weeing into the liquor, the fluid around them. It causes them no harm or you. Your baby can now suck their thumb. So your baby will be regularly sucking their own thumb. And it's around 16 weeks that, again, you might start to be noticing some flutterings or kind of bubbling sensations, because at this stage now your baby is very, very active within the womb. You might have noticed that you're really starting to show. Your uterus is no longer within the pelvis, it's now up out of the pelvis into your abdomen, so you may have started to notice that you've got a little bump. At week 17, your baby is the size of a large onion. At 17 weeks of gestation, your baby has started to form fingertips. So when I say fingertips, they've started to form their own individual fingerprints within their fingertips. A lot of women, they start to suffer with nosebleeds. Now, nosebleeds during pregnancy, this isn't as uncommon as you think. It's due to, again, the hormonal changes in pregnancy, but the way that the hormones act on the mucous membranes and the lining of those membranes. If you do find you're having a nosebleed, then just pinch the very soft tip of your nose and keep that pressure on for at least 10 to 15 minutes. Try not to release it during that time. If after about 10 to 15 minutes it's still bleeding and it's not stopping, then the advice would be for you to seek advice, get some help, speak to your GP, or go to a walk-in centre. And also, if you have experienced a nosebleed, it's advisable that for the next 24 hours that you avoid doing anything over excessive, nothing too strenuous. Avoid lifting or bending over. And also when you're having the nosebleed, try to just sit in a sitting position, stay in an upright position, and avoid lying down. So in the next video, I'm going to be talking about week 18 of pregnancy. Join me in the next episode.